The head and neck exam was always the most difficult exam in medical school. In our previous lecture, kind of went over all the anatomy. But we need to review the history and physical examination because that's always important. The pain the patient presents to your clinic with is not the same pain they started with. Because I've had enough patients who, their tooth hurt, so they went to the dentist. Says, oh, you got a cavity, you need a root canal. So I didn't get better, so they go to the dentist. They go, oh, it's the other tooth. Sorry, we missed the first time. We got to do the other root canal. And they do another root canal, and then they mess around. And then they get to your clinic, and it's an entirely different pain. Entirely different. So take a good history, examine the face and the upper cervical spine. Because the caudate nucleus of the trigeminal is at C2, C3 in that area, the nucleus caudalis. So sometimes you can have stuff in the neck referring pain to the face.